Good morning, everybody. I think people are starting to join us on today's virtual town hall meeting. This is the second of a three-part series that we're doing on municipal budgets and providing budget updates. Last week, we heard from Mark Roloff, city manager with the city of Oshkosh, and he gave a nice update for us on what has been transpiring over the past year and a bit of an outlook for the upcoming year and actually some years to follow. So it was very, very insightful. Again, we thank you all for joining us. Appreciate Mark Harris, our county executive, Winnebago County, joining us today. Mark will be doing the same as the other Mark. We got all sorts of Marks here today. We got Mark Harris, Mark Halfin with us, and we talked about Mark Roloff. So there's a lot of Marks going on here, but we are going to be recording this session. So if anybody wants to go back and review it later, you can do that off of our website. And if anybody wants to share that with somebody else who wasn't able to be here, we'll be promoting that and we're saying make people aware of that. So for those of you who have tuned in, we will be, allowing for questions to come in. So please use the Q&A button on the bottom of your screen, and I'll review those and ask those questions. We've had some questions actually that do come in offline, so we'll include those too when we do the Q&A at the end of the session. So I'll have, with that, we'll start with Mark Harris. Will kind of give us our briefing, and then we will follow that up with questions. So Mark, again, thank you for being with us. And if you want to take it away, it's all yours.
Thank you. What I'd like to start out with is just some broad overview of our next budget. And then I'll follow up with more specifics about what's going on with regard to the COVID situation. And so I'm going to try and take over your screens. Budget. Let's see.
You have the green share button?
Yes, I click that, and now I've got another box.
Then,
this will stop other screen shares. Okay.
Yeah, that's fine.
Okay. And I'm also getting a hello system resource button.
I'll turn off the background here. Maybe that'll help.
There you are. I'm hoping everyone can see now graphs of the county's expenditures, and they're in broad categories. And that's where
I'm not seeing that.
I had it up on my screen for a minute. You can't see it.
No, I can't.
How about now?
Something's coming up. Let's just give it a second here. There we go.
Okay. So you've got a pie chart in front of you?
Right.
And what that is showing you, the tables below show you the total expenditures for 2020 and 2021. As you'll see, there's a 1.3% increase in expenditures. And it's got them broken down in a broad basis. Public health, child support, veterans, human services, and park views are all under that human service wedge. Another large wedge in there is the public safety wedge and the administrative wedge. The administrative wedge is a little deceptive because fully half of that amount has to do with the self-funded insurance. And there's $17 million that flows into administration from the departments to pay for their share of healthcare. And that same 17 million then flows out to provide health care. So it's actually a wash, but it inflates that administrative number. But one of the points I want to make here is that human service, when you combined all those things, the nursing home, the social services, the veterans, that's the largest share of the county. But the county's expenditures don't just come from property tax. In fact, property tax is only about a third of the total. And I guess another screen here. Well, I jumped past one here. Let's see. Okay. So the question comes, well, where does all this money come from? And 40% of it does come from the property tax levy, but another 31% comes from intergovernmental revenues. And that's money directly from the state or federal revenues, or sometimes federal revenues that pass through the state's hands. So of that human service amount, 50 million of it actually comes from other sources other than the property tax levy. And that human services is the area that gets the most of their money from intergovernmental sources rather than from property tax. And so that if you go back and look, and the budget's about 600 pages, but in the front there's summaries with all these graphs. There's one in there that breaks it down of where does the tax levy go? Where does the money that's paid in locally to run the county go? And actually public safety is the single largest consumer of tax levy, with that whole human service category falling a little bit behind. And again, you're talking about $183 million budget, a very small increase from the prior year. Part of that is because of the intergovernmental revenues. And during this COVID epidemic, a lot of other federal monies are flowing into the county. Millions have flown into the nursing home and into private nursing homes as well to maintain the safety of residents. A large amount of money is flowing into the health department. Most of their operations with regard to COVID are covered by federal funds. And the county as a whole has an allocated share of the CARES Act monies, the Road to Recovery CARES Act monies. And our allocation was 2.77 million. But all of these things were done kind of hastily. And when the initial guidance came out, they gave us a list of what we could use that Road to Recovery CARES Act money for. And mind you, we have to spend it first and then get reimbursed. And there were several pages of things that were authorized, but all of those were things that were already being paid for with federal dollars. And there was a specific prohibition against using the Road to Recovery monies for something that was already compensated from another area. So initially, we were only allowed to use it for things that we weren't allowed to use it for. They changed their guidance. And for instance, we can now use it for certain expenses in the public safety area or in the human service area where job responsibilities were shifted due to the COVID pandemic. So we will probably be able to use much of that 2.77 million, but you're still having to follow some pretty tight criteria. This is a chart that I like to show people. This is expressing the county's tax rate as a dollar amount per $1,000 of equalized valuation. And what that is the state gives the county numbers of what the valuation is of all the communities within the county. So we spread our tax levy over those communities based on their relative equalized value, which is a market value. They then take their share and then they spread that over their assessed values. So it's a little tricky. No one actually pays this rate, but this is the rate that determines what share their community will bear. And then it's further broken down. But the main point here is that the county's taxes on an equalized basis have been shrinking for years, and they're down substantially. And that decrease comes from two sources. One, we don't get additional revenues from appreciation of property in the community. So appreciation of property tends to reduce our tax rate. The other source is our debt service. The county's debt is about half of what it was 15 years ago when I started. So we've been able to cut that debt service rate that's included in these numbers here from $1 per thousand down to 62 cents. And so that's a pretty substantial savings. I think the typical taxpayer, because the value of their home has gone up, will see stable taxes in this year or a slight decrease. Generally, the pattern's been that in the slower appreciating communities like Oshkosh, they see a decrease in their taxes. But in some of the faster appreciating areas, they've typically seen a little bit of an increase, like in Fox Crossing. But this has been a very favorable trend. I think most people in Oshkosh are going to see their county portion of their tax bill drop a little bit, and they probably have been seeing that for years, unless they've done a major home improvement project. Now I'll see if I can get out of this. Let's see. Okay. And I can talk a little bit more about what we've been doing. One of the first things the county did when this started is we realized this was going to be devastating to small businesses, especially in the hospitality area. So the county took $750,000 of the county's money, and we actually gave that to a coalition of the two major chamber of commerces in the area and Oshkosh Area Economic Development Corporation for them to administer. And we said no more than 40% of that amount could go within the city limits of Oshkosh. And the rest would have to go in areas of the county outside of Oshkosh. But in addition to that, the city of Oshkosh also did a loan program, and they funded that with excess TIF dollars, TIFs that were running surpluses. And of course, surpluses in a TIF, when it closes, 20% of those monies go to the county, because that's where they came from. They came from our taxes, which are 20% of the total load in the Oshkosh area. So the city's loan pools were also in part funded by the county to the extent of 20%. We had some other programs that we've done. We started a mortgage assistance program, and that was for people that were current on their mortgages through March, but then fell behind on their mortgage after that time because of the COVID pandemic, and that they could establish that it related to a loss of income. Perhaps one spouse worked in the hospitality industry, worked in a restaurant where the hours were cut, or in a tavern. We would help them with house payments up to $2,000, but they had to be related to loss of income from the COVID pandemic. And those are reimbursable to us through those CARES dollars. We've actually found very few people that qualify. And one of the surprising things is that household income actually rose in the second quarter of the year in Wisconsin. And that was because of all the federal transfer dollars. But we did have the program. We have a few takers. So basically trying to help people who lost substantial income because of the pandemic. Some of the additional expenses will incur over time. The road to recovery dollars will dry up before the end of this year. Even if we haven't consumed all the money, we'll no longer be able to draw on it. by December. So, so some other expenses that we might incur, it's not clear if federal dollars will cover them or local dollars. But for instance, the testing center at the county fairgrounds, that testing is currently being done by the reserves, but the county will have to displace them over time, that we have them for a limited amount of time. This 2020 is going to close out with large surpluses in the county. And 2021 will probably draw down some of those surpluses, but the county's in actually very good financial shape. We were expecting a financial downturn to come, but we just didn't expect it to come from a pandemic. And we're actually in a situation where the county has general fund reserves in excess of our outstanding debt. So if we do have to run in a deficit position due to economic circumstances, we could do that for some time. And I'll open it up then for questions.
Okay, I'm just getting back online here. We have not, if anybody has a question, please forward those on. Mark, I have a couple. Actually you must have been reading my mind. You've answered a lot of the questions that I had jotted down, which I appreciate that. But a little point of clarity. So the testing that's going on right now by out at Sunnyview, so that's all reimbursable to the county from Federal CARES Act. Is that accurate?
That's not entirely clear. Right now, that's being done primarily by the guard. It's not being done by county employees. Those are our guard employees that are conducting that. And by the way, they're doing a wonderful job of doing that, very efficient.
Mm-hmm.
But we don't have the state guard for an indefinite period. At some point, the county's participating at that testing center, and there's 3 of us. We will have to displace the guard and actually conduct the testing.
Okay. You mentioned
and that may be.
Go ahead, Mark. Sorry.
That may be reimbursable, but that's to be determined.
Okay. You mentioned that you're operating with surpluses this year, which is great to hear. So what have you guys done in terms of setting that up? I know a lot of, like the university, for example, they did a lot of furloughing and they temporarily laid people off and that sort of thing. Have you had to do that sort of thing in order to outperform on that on your budget?
No, the outperformance is coming from a policy that Human Services launched several years ago, where we were going to add additional help and that we were going to serve people in their homes rather than sending them off to state institutions. So if we can keep someone out of Winnebago mental health, we can save $900 a day on that. If we can keep someone out of Lincoln Hills or Copper Lake, we're probably saving over $500 a day on that. So we've really dramatically decreased the number of placements with state agencies and are trying to deliver those services more directly. We also added a new crisis center, which has to do with suicide prevention. And so we're actually doing more locally because we can do it a lot cheaper and with significantly better results than sending the individuals off to the state institutions. And that's the major source of savings in recent years. Great.
We're getting a couple of questions in, and some they're COVID related. What a shock! What a surprise!
Yeah.
But question here: do you have to be present with symptoms to be tested at Sunnyview? So if somebody who is asymptomatic, can they come in and just be tested weekly?
They can. There's no questioning of why you want to be tested. There is, however, getting to be long lines there. The other day there was a 3-hour wait just because there were so many cars and they were spilling out on County Y. So I would encourage people to be reasonable in their desire to get tested, that you would have to have some reason that you would question it. But I actually had a meeting with a county employee who found out immediately after the meeting that he had tested positive. But we kept a big separation in the room we met, and we were both masked. But I felt I owed it to my other workers to go in and get a test just to make sure, even though that exposure was of relatively low risk. So I went in and the wait was less than an hour. But as this spreads and the number of people that are concerned about it increases, the lines can get longer. We now have well over 4,000 positive cases in the county. And remember, our health area only covers a portion of the county. It doesn't cover Menasha or the portion of Appleton that's in Winnebago County. So it's only about 150,000 people that are covered in our health department service area. And we're approaching 5,000 confirmed cases of COVID, but some of those are probably asymptomatic.
Well, and that's from the beginning of the year too. I mean, there have been recoveries and there's certainly.
That's correct. That's the totally.
Okay. Question again relating to that.
Yeah, I would guess less than half of those are active.
Okay. All right. Question that came in is, since there's a major source of COVID positive cases in county facilities like the jail, Winnebago Health Center, and I understand also the correctional institution here at about 300 cases. Why does the county health officer want to close down businesses?
Well, actually, we don't have a significant caseload. The county's nursing home, I think, has only had 4 people, one of which was a false positive. I'm not sure. The jail only had 1 individual I'm aware of, and that was an individual that came in and already had it, so he was kept isolated. You are correct. The state prison has had a large number of inmates and a smaller number of staff. I think we're over 40 staff from the prison that have it. And that's actually more concerning, because the prisoners are already somewhat isolated from the rest of the community, but the prison staff is not. But there's multiple sources. When the university came back in and the schools were back in session, we were getting cases from both of those, but they never were the sole cases. And we still think that some of the highest transmission is occurring outside of institutions, but in the community among people that are not being cautious with masking.
In terms of, we're pretty lucky here. We have outstanding health systems with their, state of care, Aurora, Ascension. They've been doing a remarkable job. Any insight in terms of how much hospital capacity that we still have in the county to treat COVID cases?
I couldn't tell you overall, but I can just go by the comments that were made to me that both Affinity and Aurora were approaching their capacity in this community, and that they've already maybe reached and exceeded their capacity up in Appleton and Green Bay. So capacity is becoming a problem, and it's really hard to know if the cases will continue to increase at their current rate. I mean, we're probably running between 100 and 150 new confirmed cases a day here. I don't know how long that'll last, but if it continued at that rate, a certain percentage of those are going to need hospital care, and a very small percentage of them might eventually die, in fact. But that would certainly overwhelm the capacity of the hospitals in the near future. And like I say, in Green Bay And in Appleton, they feel they're already at capacity or beyond.
Yeah, I think most of them are still continuing elective procedures, which, I think back in, when was it, March, April, a lot of those hospitals discontinued those, which freed up space, put them in some economic challenges for themselves, unfortunately. And luckily they haven't had to, discontinue those sorts of elective procedures. So,
I think
which
they
was
already have limited elective procedures in Appleton and Green Bay.
okay. The state Department of Health Services, has been, issuing a lot of guidance, and the most recent one, came down, is actually effective today. A lot of people are kind of scrambling, trying to figure out. I know we had some communication yesterday, and we had some communications with the city, and also the chief of police, in terms of how that's going to be implemented and enforced, and that sort of thing. I know there was a meeting on Monday which I participated in. I know Doug Euring, your public health director, was there. And, people are trying to do the right thing. People are trying to figure out, how can they be helpful? How can they, be part of a solution here? So, I mean, what's your thought between, taking more local corrective actions, or as it relates to, waiting for DHS guidance on, as it relates to COVID actions, and, how do we balance all that stuff? Because it's very, very, very confusing.
It is, and it's become a politically difficult position. The state legislature has indicated that they won't take any action with regard to COVID, that they'll rely entirely on the local health officers. But 70 of the counties did not have language in their county codes that allowed for enforcement. And as counties attempt to add it back to their code, they're experiencing extreme resistance. And in fact, most counties that have tried to amend their codes to allow for enforcement of orders have not succeeded because of public pressure. Well, that means the state legislature is relying entirely on the counties, and the counties can't actually enforce orders. So it's a very difficult position. It certainly takes pressure off of us if the state acts instead, but I can envision a time where you need a much more local. I mean, I don't think anybody wants to do a total lockdown again, but you might have individual hot spots. You might have an individual gathering place that has a real problem, and you might want to do an order involving a particular business. Imagine there's a tavern that has COVID positive employees still serving drinks, and you become aware that there's a large number of people related to that business. Well, you might want to require them to test all their employees and to shut down until they have enough staff that have gotten negative test results. We can't do that right now, really, because of the way the state statutes, which give us an absolute right to issue orders, don't work well with the county code that doesn't give us the ability to enforce. So it's a difficult position. Most people in the community seem to have strong feelings one way or another. So I'm getting a little hate mail from both sides that the county's doing too little, and some that fear that we'll try and do too much. So that's where we're at.
Well, I haven't sent you any lately, so I'm
Okay.
giving you a break there. But it's a tough situation. I mean, a lot of companies are voluntarily doing a lot of things, and we see it every day, and people are, I haven't run across people who are saying, I want to do the wrong thing. I mean, I think people are looking to do the right thing. So another question.
But
Go ahead.
there is a quirk, though, that when the stay-at-home order ended, that was one thing, but something should have been put in its place. And a lot of people immediately crowded into bars and restaurants as if there's no order, it must be safe for us to do that now. And that wasn't at all the case. We could see that there was a slow build in community transmission. And I think there's a 50-50 chance that the state's mask order is going to be struck down. And I think it's highly unlikely that it'll be renewed once it expires. So either way, if it's struck down or if it expires, there's going to be no mask requirement. I think there'll be a significant minority of the population that will interpret that to mean that it's now safe to have close contact with other people without masks. And again, that would be a wrong conclusion.
You know, and should that happen, I see, you know, in talking to some businesses, I think they would still voluntarily continue, you know, posting, you know, come to my place of business, we prefer that you wear a mask. And, you know, I mean, if you're invited to somebody's house or somebody's place of business, if they say, you know, want to conduct business here, you know, wear a mask. I think for the most part, people, you know, comply with those requests. You know, time will tell here to see what happens. Question that came, and another question came in again, more COVID related. You mentioned looking at hotspots. You know, would one of those hotspots potentially be the UWO campus?
Mhm.
And that you know would potentially look to lock down. The comment here is they're responsible for, I don't know if this is a good right number or not, for over 600 positive COVID cases.
They're doing a lot of testing and they are reacting well to the situation, but like the public schools, they may find that they have to go to all virtual classes at some point. I'm not sure where they're at right now. Some campuses have already gone there.
Yeah.
Um,
I think they're
and
still operating as
I know they've got.
Go ahead, Mark. Sorry.
No, that's right. I'm not sure if they're still doing as many in-person classes as they were before, but a lot of the university campuses have gone to all virtual classes again. And some have even had lockdowns on dorms where there was a lot of cases. One of the problems with that is that the students then drift home and they can do their virtual classes online from home. But then you're in a concentrated area, you spread it, and they allow those to go home. You know, they're drawn from a larger area than just the local community. They will then tend to spread that elsewhere. So that's a risk. We do believe though that the most of the transmission right now is not coming from the campus, although a significant amount is there. We think it's just general community spread, and there's so much of it in the community now that we made the New York Times list of highest per capita increase in positive cases. We made that list the other day. And in fact, 9 of the 20 worst metropolitan areas in the country were in Wisconsin.
I think we're on that list. We were on that list one time, I believe in June, for a period of time, and you know, kind of, worked our way out of that for a variety of different reasons. So, question going kind of back to budget. We when we talked with Mark Roloff last week, you know, he painted a pretty positive picture for their budget going into next year, but had it was a little fuzzier or a little more concerning for future years, specifically, you know, where our property value is going to go as relates to, you know, impact on you know, businesses, property values, and that sort of thing. You know, what are you hearing? What are you seeing that may look like for the county, and you know, not 2021 specifically, but more 2022, 2023.
I would be very concerned that state revenues will drop and federal revenues will drop. because of less people working. And, I think the layoffs are still coming in most industries. And that then puts in question those intergovernmental revenues that we get from the federal and the state government. But we're actually in a position where we could ride out a pretty significant cut in intergovernmental revenues for 2 or 3 years.
You've been able to manage your budget, actually very well over the last, several years. I mean, your fund balance, I think, is over 20 million bucks. I understand.
Yes, and in fact, we have a policy on fund balance, and we believe when we close out this year, we'll exceed the top of the range that we've set. So that will require us to use that money to reduce indebtedness. So we will probably be buying back, we will call 2 small bond issues that are at a higher rate of interest. We could have funded this year's capital budget out of reserves or partially out of reserves. But since we believe our bonds will go out at about 1%, it didn't make sense to reduce that borrowing. It makes more sense to buy back some callable issues that are closer to 2.5%.
Right. Well, I don't see bonding going much below 1%. I wouldn't believe, but maybe they'll be giving you money at some point.
I wouldn't object. I actually think though we'll be borrowing less money in the future, that until we get that surplus balance down a little bit, we'll probably be using a combination of general fund reserves and bonding to do the road projects, building improvements. We won't be borrowing for all of those. We'll be funding some of those out of those reserves. And that'll bring our debt down even further. We're down below 6% of the allowable debt balance.
Yeah, that's significant. I mean, you mentioned before you brought that down by half.
Yes.
So that's
Sorry.
great.
Lost my microphone. Okay. Yes. Yeah, it's down by half. We could actually pay off our entire indebtedness with that reserve, but it wouldn't make sense to do so when so much of that debt's at such a low interest rate.
Right. I know our neighboring county, and this is one of my favorite topics, one of my favorite taxes, the half-cent sales tax, as you know. But Outagamie, I think, went to implemented that at the beginning of the year, beginning of January, and right before COVID hit, and it certainly impacted resale taxes or retail taxes. What have you heard out of Outagamie County in terms of what they're, I'm guessing they're far below their revenue projections in terms of what that half-cent sale tax was supposed to be bringing in for the county.
I would guess they're a little bit below expectations, but actually because household income held up in that second quarter, I've talked to several counties and they said that their sales tax revenues were running even with or ahead of last year's. But that was all on those, the $1,200 stimulus checks, the bonus unemployment money. As those things, as that money spent, if it's not replaced, then I'm sure the third and fourth quarters will see a decline in sales tax. Now, don't have the ours comes from property tax, and that's real stable. But I anticipate over time that we're going to see a lot of landlords struggling to pay their property taxes if there's a moratorium on evicting people for not paying rent. And while you want people to continue to have their housing, you have to understand there's a long-term negative effect on landlords if they can't collect rent and expel tenants that aren't paying. So finding the right balance there is going to be very tricky.
Yeah, it's putting a lot of pressure on folks, and not just landlords. I mean, the order that started today with the limiting occupancy to 25% is, I mean, it's really going to hit restaurants, bars, probably harder than most. And I've talked to a lot of restaurant owners. They said, 25% capacity, I can't even, I mean, it doesn't pay for me to open the doors, you know, their cost of, you know, for opening doors doesn't even, you know, they won't recoup that. So, you know, there's more hardship to come there, I think, you know, moving forward. Plus you take the, those that have been able to do outdoor dining, I mean, the weather's starting to turn fall here shortly. So, you know, that piece of their revenue pie has been, will be displaced, will be gone. And, you know, they won't be able to go indoors because of these restrictions. So, you know, there's this bubble coming down the pipe here that I think is going to have some, you know, pretty severe impacts, not just on those businesses, but also the you know, city, the county, and other taxing entities that rely on that. So, one last question, Mark, and appreciate again you joining us. So when the county board's taking this up, they're having their budget hearings when, and what's that process?
That's late in October, and I don't actually have the date in front of me, but it's after our regular board meeting, so it's a week or so before the end of the month, and it's on a Monday near the end of the month, and I just don't have the date in front of me. But they'll take it up. It's going to have to be a virtual meeting, and generally we just walk through the budget for about 3 days, and then the board proposes their amendments.
That's a tough virtual meeting to sit through.
It's very painful.
So, all right. Well, with that, I think that's you know, that's questions we have. Again, you know, hey Mark, thanks for joining us. We have recorded this this session, so if anybody wants to relive it, they can go to our website. It'll be on our website for viewing later today. So, you know, please share that with others if you would like. Again, you know, this was the second of our third part of our 3-part series. Next Thursday we have Vicki Cartwright, Oshkosh Area School District Superintendent, joining us, and she'll be talking about Oshkosh Area School District's budget, and probably also be talking a bit about their referendum that's coming up here on November 3rd. So with that, Mark, thank you for joining us. For our studio audience, thank you for joining us too, and we will reconvene next week. Oh, and then one last thing, down the road on the 22nd and 29th of October, we are holding candidate debates at 8 o'clock on those mornings with the 54th Assembly District Representative Gordon Hintz and his challenger Donnie Herman. And then the following Thursday on that 29th, we got State Senator Dan Fine and his challenger Aaron, I think it's Wojciechowski, will be squaring off. Again, we'll be doing a Zoom on that, and also it'll be broadcast live, I believe, on WOSH. So if you're looking for those, again, Mark, thank you for joining us, and we will see you all next time. Thanks.
Thanks for the opportunity.